Hello YouTube, I am back again, and today we're talking about another diabetes related topic, which is great. But this is going to be another heavy one, and I'm going to be talking about mental illness and type 1 diabetes, specifically type 1 diabetes because that is what I am familiar with. I'm a type 1 diabetic. My name is Shayna, and we're going to talk about some maybe startling, maybe comforting things about mental illness and diabetes. So when I was diagnosed, I had no clue, and I'm sure most people don't have any clue, that there are a lot of mental ramifications that come with being diagnosed with type 1 diabetes, so just a little bit about me and my history. So my family has a history of depression. My dad experiences extreme depression and anxiety. I have a long history of mental health issues in my family. So I always thought when I was experiencing anxiety and depression and things like that, that it was just a direct result of my biology. And I think looking back on it now, I'm 22 years old, I have a little bit more hindsight. And I think that for me, the stress and just mental exhaustion of dealing day in, day out with a chronic condition has really taken a huge toll on me. And I kind of want to go into my own experience with depression and anxiety and mental health issues, and also just bring you guys up to date on some of the statistics. So what's really interesting is some of the statistics about surrounding diabetes and mental health conditions. So according to the Center for Disease Control, diabetic individuals, type 1 diabetics, are 2 to 3 times more likely to be diagnosed with clinical depression throughout the course of their life. 2 to 3 times more likely. And somewhere between 25 and 35% of these people will never receive any sort of medical treatment or help or therapy for this condition. So that's a pretty significant statistic, and it means that if you are someone who is a type 1 diabetic and you are experiencing feelings of depression, this might not be the exact reason why per se, but it can be a huge contributing factor. So the next statistic is surrounding anxiety disorders, and this is what I was personally diagnosed with. I had GAD, generalized anxiety disorder, and I'll talk about my diagnoses in a little while, but basically diabetics are 20% more likely to experience or be diagnosed with an anxiety disorder. So the statistic that really stuck out to me was the one surrounding eating disorders. And the Center for Disease Control estimates that 30% of type 1 diabetic females will experience an eating disorder or some sort of disordered eating behaviors. And this is the thing that really stuck out to me. And I am someone who's always struggled with my weight. I've talked about it in the last 2 videos, I guess. It's just what I talk about now. And if you are a type 1 diabetic, you may or may not have heard about bulimia. If you're not a type 1 diabetic, I'm sure you haven't heard about bulimia. But basically it is a really, really serious eating disorder wherein usually females, maybe not usually, but a type 1 diabetic will give themselves less insulin, or maybe will skip insulin injections in general to induce DKA and to lose weight. And this is super dangerous. It can lead to a coma. It can lead to chronically high blood sugars, and it makes you really sick. And ultimately, you will gain the weight back once you start taking normal insulin and things like that. So it is an ineffective way to lose weight, certainly. And it's also it's an eating disorder. It's very, very problematic behavior. But I wanted to briefly talk about why it is that diabetics are more likely to experience anxiety and depression and eating disorders. And basically, I want to talk about also just like my own story, my own experience dealing with mental health issues and things like that as a type 1 diabetic lady. So I was 11 years old when I was diagnosed. If you're interested in that story, I posted it a couple days ago. I will link it down below. But I was diagnosed at 11 years old, and I very, very quickly developed, first of all, bad habits as a diabetic. I did not have very good control. I still kind of don't, but that's for another video, I suppose. So basically, the issue I've always had with my diabetes management is it's always been testing my blood sugar. I've never tested my blood sugar as often as I should or as has been recommended to me. Now I have a continuous glucose monitor, so my control is significantly better. But I developed a lot of anxiety surrounding testing my blood sugar. It really became clear to me later on in life that when I would see that number, to me, it would tell me, you're a good diabetic, you're a bad diabetic. You're doing a good job, you're doing a bad job. And I think that this mindset, I'm sure lots of diabetics have fallen into. And it's, especially if you're a perfectionist or you're someone who maybe you're used to getting high or, good grades, you're used to getting A's, or you're a capable person, I'm sure you are. And when your numbers don't exactly align with what you're expecting, it feels like a moral failing. And it's not, but it feels like it. And I think that a lot of people probably also develop this kind of anxiety where, for me at least, the solution was just not testing my blood sugar. And that's not a solution, and it's not a viable option, but it's what I did for many, many years. And I would maybe test my blood sugar once a day, maybe. And if you're a diabetic, you would understand that that means it means a few things. It means that I had no idea what my blood sugar was before I would eat. It means that I was kind of just shooting in the dark in terms of giving myself insulin injections. And I'm not certain how common this is, of just not testing your blood sugar, but that was always my biggest issue in terms of diabetes. And when I was younger, I had one endocrinologist, and he was actually the one who was not in the room, but he was one of my endocrinologists when I was diagnosed. So he knew me, when I was 11, and then I continued to see him when I was 12, 13, 14. And the issue was I had very strict control, maybe the first 3 months or something after I was diagnosed. And if you know something about diabetes, you also know that there's this honeymoon period in which you are still producing some of your own insulin. Very little, but you're still producing some of your own insulin, and people tend to have better or lower numbers during this time. And so my A1C, or my, it's kind of like an average look at your blood sugar. My A1C at this time, excuse me, my A1C at this time was very low. It was really good. I think it was like a 6.5, and it has never been that good since then. Hopefully it will be able to be that good later on in my life, but that's just not where I am right now. Anyways, so from that point forward, my A1C just went up and up and up. And this endocrinologist that I would see, he was an old guy, and he was very smart, and he liked me a lot, but he would really use so much guilt when he was dealing with me. And he would really constantly go back to that first A1C that I had. And he would say, like, I know it's possible. You've done it before. You're not trying hard enough. And truthfully, he would throw in my face this is how it felt to me. He would throw in my face the long-term complications that come with not managing your diabetes properly. And if you're a type 1 diabetic, you know what the outcome is going to be. You've heard all of the horror stories. For me, I saw my uncle have a stroke, who was a type 1 diabetic, have a stroke and die. And that's very serious. Like, I constantly have heard from everyone in my life, you know, you could go blind, you could lose a limb, you could have a stroke. All of these things will happen to you if you don't manage your diabetes right now. And that is a lot to put on a young person. And I just felt so defeated. I felt like there was just never going to be a time in my life where I would be able to manage my diabetes properly. And there was just, I really grew to hate going to the endocrinologist. And I still am dealing with this to this day, really advocating for myself as a patient and saying, like, you know, it's not that easy. The things that sometimes my endocrinologist would recommend, which at one point he would recommend, like, waking up, setting an alarm to wake up 2 times during the night to test my blood sugar, and it just wasn't realistic. And I felt frustrated, and I would lie to healthcare professionals because I was ashamed and I knew what I technically should be doing, and it just was never something that I saw myself doing. They would recommend that I, you know, weigh and measure my food so that I could get more accurate carb counts. And I would never do that. I don't do that today. If you do that, that's great, and it works for you, that's great. But it's just not for me, honestly. And I felt frustrated because I felt like these healthcare professionals were telling me things that they themselves would never do. And I really, really desperately wanted someone to just understand. You know, I wanted someone to tell me, God, like, this is hard. I know this is hard. Even though you're not taking great care of yourself, the little amount of management and stuff that you're doing, it's still difficult. And I just desperately wanted someone to understand that aspect of my life. So I really started when I was probably 12 and 13. I started dealing with a lot of anxiety and depression, and I didn't know why. I didn't know where it was coming from. I felt desperate, and I felt ashamed, and I felt confused, and I felt like I didn't know where to turn. And I started getting really bad panic attacks when I would go into my endocrinologist, because I just felt that shame. I felt like I was a disappointment. It felt extremely personal. It felt, like I said, it felt like a moral failing, and it felt like I was letting everyone down. My parents, you know, my doctors, everyone, myself. I felt like I was letting everyone down, and I started experiencing some really severe panic attacks where I would just sob uncontrollably in the doctor's office. And, you know, I'm not sure exactly when it was. I think I was probably around 13 years old. And a nurse actually told me, you know, it's very common for diabetics to experience anxiety and depression. And she gave me a list of some psychiatrists, and she said, you know, give this list to your parents. I can talk to them if you want to, or you can, and you know, we can work this out with you. You know, someone will be able to help you, even if it's just through talk therapy or what have you. And that turned my life around, honestly. I saw a psychiatrist, and I started describing some of the things that I was dealing with, and she put me on some medication, an SSRI, Zoloft, and it changed my whole life. I stopped having panic attacks. I still hated going to the endocrinologist. My control of diabetes didn't get better, but my life got better. And I think that if you are someone who is struggling with anxiety and depression or some sort of mental health issue, I would really strongly encourage you to reach out, to find someone who will listen, especially if you're a diabetic, especially if you're dealing with a chronic illness. It weighs heavy on you, dude. I have been there. I know what that's like, and it's very difficult. And actually, more recently, I would love to talk about, I actually went to a diabetes therapist, like a diabetes specialist therapist, and that was life-changing. I only saw her a couple of times, but honestly, to have somebody who at least is literate and understands the disease, to have a healthcare professional be on your side and to tell you, like, I know this is difficult. The only reason she is there is to hear you and to understand you and to help you cope with the seriousness of this disease and the weight of carrying this disease every day. And she was compassionate and understanding, and she told me, I'm not a failure. And it was honestly life-changing for me to hear that, especially from a healthcare professional when I've felt so alienated by healthcare professionals in my past. And I don't know how common a diabetes therapist specialist is, but I know that if I worked with her more consistently, I know it would help not only mentally, but it would help me physically and help me create better habits regarding my diabetes. And I was unable to keep seeing her because I moved, but I would definitely recommend. I think that if you are somebody who experiences a lot of anxiety and that shame and fear surrounding certain issues with your diabetes, I would definitely recommend seeking out that kind of source. And because it's a third party, it's an objective standpoint, it's different than your friends or your family telling you, you're doing an amazing job, you're doing great, keep going. And having her validate me was actually so healing for me. And she really explained why it is I have this anxiety surrounding testing my blood sugar. And she was one of the first healthcare professionals that I felt like I could be completely honest with. And that's something I mentioned before, is that I had a hard time telling the truth, even especially to my parents, who could never understand why it was I was struggling to manage this disease so much, because I'm smart and I'm capable. And they didn't understand, like, what was the barrier. And talking to this diabetes specialist, this therapist, she completely understood. She had talked to people who hadn't tested their blood sugar in years. And she provided that judgment-free kind of environment where I could actually confront the truth about my management, and I could actually say, no, I haven't tested my blood sugar in 3 days, which I would never admit to, because I felt the shame and I felt the guilt, and I knew intellectually what I should be doing regarding my diabetes. I knew that not testing my blood sugar for days was dangerous, and I knew that it was bad for me. But if I couldn't be honest about that, then I didn't have a starting point. that worked for me because I was starting off on a lie. So they were saying, you know, oh, well, you're testing your blood sugar twice a day. Let's bump that up to 3 times a day. When in reality, I was actually testing my blood sugar maybe once a day. So that 3 times was just out of reach. So what I'm trying to say is, if you are someone who feels like a bad diabetic, you internalize that and you feel like you will never get a grasp on this disease. I will tell you something that my diabetes therapist told me, and it really changed my perspective. And I try to tell myself this all the time, and that is, the good news and the bad news is you will have this disease for the rest of your life. Which means you have a lot of opportunities to get it right. And that should inspire you. And it's scary, but it means that every single day you have a new opportunity. Every second of the day you have a new opportunity to get it right. And you'll never hack diabetes. Like, you just won't. Like, you can still do everything exactly right and things will go wrong. And that's okay. You're never going to perfect it. You're never going to win. Diabetes is always going to win, but that doesn't mean you're not going to have your personal victories along the way. And if you are someone who feels really down about this disease, and it's hard not to, right? Just know that you are not alone. You are not the worst diabetic that has ever lived. And to be a bad diabetic does not mean you're a bad person. And to have a bad day as a diabetic honestly means nothing on the large scheme of things. I don't know if anyone is going to relate to this video at all, but I hope someone does. And I hope if you are someone who feels desperate and lost in this journey of chronic illness and diabetes, I hope that you can hear my words and understand that it is never too late to turn it around for yourself. Every day is a new day, and you have 1,000,001 tries from now on. It doesn't matter what you did yesterday or the day before. It doesn't matter if your doctors are disappointed in you. I am inspired by you. I love you. I think you can do an amazing job. And even if your blood sugars are all over the place, you are still doing way more than 99% of people in this world, because you are getting up every day and trying to live your very best life. And if you're a type 1 diabetic and you have an understanding family, or a family that wants to understand, wants to help you, I would recommend letting them in. Friends want to help. If they want to shoulder some of the burden, I would completely recommend letting them in, having them ask them to educate themselves about it. You don't have to educate them about your disease if you don't want to. There are tons of online resources, tons and tons and tons, and you should not have to go through this alone. And ask them to really take a sympathetic approach. It's something that I think I would have benefited from greatly. I'm a little bit too old for that now. I live on my own, so it's a little too late to let my family in on it. But as far as my boyfriend, I tell him about all my struggles. He knows about my Dexcom. He knows about all of these things. And it is really helpful to have someone on your side who is rooting for you and who is looking out for you. So on that note, I hope you guys really enjoyed this video. I know it's a bit of a downer, but I hope it is relatable or interesting to you. And I will see you guys all in the next one. Thanks for joining me.